right. Well, won't make people wait. So, Dr. Michael Twyman. I'm a heart attack prevention expert located here in St. Louis, Missouri. My main practice is Apollo Cardiology, and I help people reduce the risk of having heart attacks and strokes. I'm a semi-professional biohacker and health optimizer. I got into biohacking in 2017 after a trip to Bhutan. Bhutan is a small country sandwiched between China and India, but it's 14 hours from St. Louis. And I was trying to figure out how not to die from the jet lag going over there. So I stumbled upon some articles about blue-blackened glasses. Didn't understand the science behind light at that point, but wore the glasses anyway. And the jet lag was maybe about 1/3 as bad as I thought it would be going over there. So when I got back, I started reading deeply on how light affects biology, and haven't stopped in the past 3 or 4 years. And that's what led us to tonight. For those just joining, thanks for joining. I'm Dr. Michael Twyman. These talks, this is kind of the trifecta. I've done 2 previous talks on previous Monday nights. The first one was on photobiomodulation and cardiovascular health. Last week's was on musculoskeletal health. Both of those videos are available on IGTV if you're on Instagram. But I also do have them on my new website, redlightdoc.com. And any type of interesting articles or other types of things that I find interesting in the photobiomodulation world, I'll put up on there. Tonight we're going to be talking about photobiomodulation and brain health. There's a device we're going to do some show and tell with and share my personal experiences with. It'll be the Weber LED helmet. I'll go through the mechanism action of how this is reported to work, and then also go through some of the examples of things that this might be useful for. Mind you, I am a cardiologist, so brain health isn't necessarily my area of expertise, but anything that treats the mitochondria and gives more energy, if you can fix it up in the brain, it's going to fix it anywhere else in your system as well. So, in my previous videos, I've talked a little bit more deeply about kind of dosing. The dosing, I'm not going to go into directly tonight. If you want to know the dosing, you're going to have to look at the actual articles and read them for yourself, because this is definitely one of those things where you just test, don't guess. And it's apples to oranges using other red light devices or infrared devices and brain health. So there are a couple companies that make some devices, the V-Light, the Weber laser, and then there's a couple of newer ones coming on the market pretty soon. But for the most part, I do get the question, can you use one of these, red light panels to do brain health? Unlikely. The red light in and of itself is not going to be able to penetrate the hair and the skull and actually get to the brain. You're, for the most part, going to have to use near infrared. And one of the most studied wavelengths is 810 nanometers. So you'll be hearing me talk about that tonight. So in my previous talks, I kind of went through that there was an article I'd read that really kind of laid out, the 8 major parameters you need to look at for how to dose photobiomodulation. One is going to be the wavelength or the color of light. So tonight, I'm mostly going to be talking about near infrared, 810 nanometers. What is the power? So, that's going to be measured in watts. The device tonight is 16 watts. There's essentially 320 50 milliwatt diodes, and then spot size, this thing's pretty close to your head. I don't have the exact spot size, but the irradiance, it's 15 to 35 milliwatts per centimeter squared. The pulse regimen, which is very interesting, can be 0, can be all the way up to 20,000 hertz. But for the most part, after 100 hertz, it's essentially the same effect to the cells as being continuous. So this device, generally, you either use it continuous, 10 hertz or 40 hertz. Those are kind of the major studied frequencies. The treatment time, we'll go through what the recommendations are for this helmet, but you want to know how long is each session, how many times a week, and then how for many periods, is it an 8-week trial, 12-week trial? You want to try to stay as close as possible to what was actually studied in trials. Then there's energy influence, which I'm not going to necessarily explain the exact details tonight, but those will be listed in the articles if you're looking for the actual dosing. But for the most part, dosing is going to be the power density, how many photons are being shot out of the device, times the amount of time that the light is interacting with whatever surface. So, previous weeks I've shown my little friend, the mitomite, the little mitochondria guy. So the mitochondria, these are the organelles in your cells that make energy. the majority of the mitochondria are located in your brain and heart, and those areas are the two leading spots where people have chronic diseases. You can think of it someone as a brownout of energy if you can't make enough energy in the mitochondria. So we've talked previously about the cardiovascular ones. Tonight we're going to talk about the brain ones. What are some of the things that brain photobiomodulation can treat? You can somewhat break it up into three categories and maybe even add a fourth category. So the first one's going to be traumatic, so acute stroke. There's been a couple of trials, the NEST-1 and NEST-2 trial, looking at the safety and feasibility of using one of these type of devices in stroke to decrease the ischemic area. Acute and chronic traumatic brain injuries. So this is going to be of interest for people who treat these type of patients. So athletes and military people exposed to blast injuries and such. This may be a benefit. Then the neurodegenerative ones. The major ones are Alzheimer's and Parkinson's, but the other ones, Huntington's and ALS and such. There's probably very, very few case reports on those, but you kind of look at the mechanism of action of photobiomodulation, and sometimes it's if it's not likely to cause any harm, maybe you're going to try it in those type of cases. Then psychiatric, depression probably has the most data with these type of devices. Anxiety has some, PTSD has some as well. And then, which will be interesting more for my wife, who's a developmental pediatrician, there's not a lot of data, but there's thoughts that potentially something like this might be able to be used for autistic patients at some point, or ones with ADHD or Asperger's. So those are kind of the four big categories: traumatic, neurodegenerative, psychiatric, and neurodevelopmental. Like I said earlier, I'm somewhat of a semi-professional biohacker, so I'm looking more at the cognitive enhancement for somebody who, as far as I know, has a healthy brain. So how does the photobiomodulation actually work? The most likely cause of action is still that the light is interacting with cytochrome C oxidase of the respiratory chain in the mitochondria. Let's see if this will show decently on the screen, but that's what a mitochondria would look like. And then there's different little respiratory proteins, a little chain. The ones where the little red arrows are pointing down, that's cytochrome 4, and then the one that's a little bit bigger is called the ATPase. So cytochrome 4 is where the mechanism of action of red light works, but also infrared light. And the way to think about this is if I use my fingers as the example instead, so if this is cytochrome 4 and this is ATPase, electrons get passed along, and at the end, there's a little top that spins. The faster it spins, the more energy eventually gets pumped out. It's a little bit simplistic to say that way, but that's the best way to think about it tonight. Is the faster that thing spins, more ATP or energy currency gets pumped out. The infrared light interacts with nitric oxide. The nitric oxide somewhat acts as a brake. It prevents those electrons from going really fast through the electron chain transport. That infrared light then hits it, knocks the nitric oxide off, and then energy can go through, or the electrons can go through that chain. The ATPase spins, more ATP, more energy, more ability to run things. So it's kind of like having a more higher charged iPhone. It works for longer periods of time. But then that nitric oxide, after it's been photodissociated, goes out, it improves lymphatic flow, and this then increases cerebral blood flow, which a lot of the benefits of photobiomodulation in the brain comes from increased blood flow, especially to kind of the frontal lobe areas. Then other cellular pathways are activated when nitric oxide gets photodissociated. Briefly, there's actually an increase of reactive oxygen species, and so, many times people think, oxidative stress is always bad. No, it just tells your body, this is what's going on. Your body then makes these other protective antioxidants, quenches those signaling molecules, and then something downstream happens. Those things downstream, generally, transcription factors get turned on. It makes different proteins, and then your body, does what it does with those proteins. So sometimes, the acute effect is more energy, but downstream, you activate the DNA and more proteins get made. So that's how the light therapy actually works. Earlier, I talked about that, for the most part, this is going to be near infrared, light that you cannot see. The reason being is that the red light, as you can see, I'm using a red light to the side to kind of balance out the blue light from the technology I'm talking to you guys on. That red light mostly is reflected off my skin. Not a lot of it's getting, some penetrates into the skin, but it's not going through the skull and activating pathways in the brain. So there is cadaveric studies done with these 810 nanometers, and for the most part, the light was penetrating 4 to 5 centimeters, but getting into about 3 centimeters of the brain. So you're activating the outer part of the brain. So sometimes you're just increasing the blood flow to the front part or activating one of the motor strips. But then there are kind of far field effects. Maybe it's that you're stimulating the red blood cells with the light, and then those red blood cells act as a ferry boat, take the light to where it's needed. Or again, you activate these transcription factors, more proteins are made, and that those act far away from where actually the light is shining. So now I think I'll kind of go over a little bit of the show and tell on the rubber device. Comes in a nice carrying case, but I'll spare you that part. But let's see if I can actually get a good picture of it tonight. Usually I'm a little bit too close to the screen, but looks like a super fancy bike helmet. And inside you can see all the diodes. They're all infrared. There are a couple LED ones, just so you know that when it's turned on that it's actually working. But I'll go ahead and plug it in now. So, of course, being a biohacker, I did have to biohack the control panel. The control panel puts out a lot of blue light, so I got a screen protector from one of my old iPhone 7s and put it on it. Came from lowbluelights.com, so now it filters out all the blue light. So, typically I use this thing more in the early morning, and I don't want to be exposed to a bunch of blue light. But I got a power cord, plug it into the thing, and it gives this nice, lovely melody. All right. Hey, Jeremy, thanks for joining tonight. So you can see this on the screen. Has a timer. Usually the sessions are between 15 and 30 minutes long. The intensity, I'll tell you here in a minute, you probably want to start at the 25% intensity. Less is more with this thing, unless you know what you're doing with it. I can tell you from, let's say, somebody I know closely, if you use it too high too soon, you might have an effect. Not permanent, but an effect that you probably do not want to have. So start very slow and work your way up. So probably start at 25% intensity initially. Then there's going to be the frequency. I'll show you can dial it in. You can dial it as 0, so you have continuous pulsing, or you can turn it on at 10 hertz or 40 hertz or whatever you want. But for the most part, the data is on 10 and 40 hertz. And then you hit go. So I already did a session earlier today, so I'm not going to do a super long one, but maybe I'll do 15 minutes while we're chatting. I'm going to pick 15 minutes. I'll do it at 75% intensity and no pulsing, because pulsing, I'll tell you in a minute what it does to me at least. So put on the Doc Brown Great Scott helmet and fire this thing up. So now the little thing pulses, saying that the near infrared is now penetrating my skull. And I've never actually given a talk with this thing on. I don't think I'll have any problems, because for the most part, when you're using it in continuous mode, it just makes you more alert, can improve executive function. So, I don't know if I could sit around and take a standardized test with this thing on, but that might be pretty interesting. But typically the way I would use it for myself is at continuous, if you want to be more alert and be able to concentrate on something. So I use this one, more generally in the morning time. I usually would not, for myself, have it on at high intensity with no pulsing late at night. So that's my experience with it. For the data on Alzheimer's and depression, for the most part, they're using 40 hertz at the higher intensities. And if you're using it for anxiety or ADHD, you use it at lower intensities, and generally the frequency is going to be at 10 hertz, which is very close to the alpha waves. So the first times I was using this, I was using it more at the 10 hertz setting, and I've been a pretty routine meditator for the past 3-4 years or so. Right now I'm not doing anything particular other than I use like a Insight timer, just sets a little bell and just do my own little thing. But like a good biohacker, sometimes I actually did meditate with this thing on my head. I do 20-minute sessions with it on. and was doing it at 50% intensity at 10 hertz. And I can tell you when I was done with it, it felt like an extremely deep meditative state. So anytime I run this thing at 10 hertz, I'm not doing anything else. I'm not talking to people. I'm not looking at a phone. I'm not reading. I just leave it on and then just, contemplate things, just look out the window and just, do some deep breathing, and you will get into this very deep, relaxed state, when it's set at 10 hertz. But I will say, if you set it up too high, it's going to keep you in that kind of deep, relaxed state for an hour or two. So, if you need to get up and go, be extremely active, if you want to go exercise, or you need to, be super with it for a business meeting, you maybe want to use this one at a different time of day, at least in my own personal experience. So those are kind of my experiences with it. I mostly only use the 10 hertz when I want to kind of be in that meditative state, and I use it more in the continuous mode when I want to be a little bit more alerting and bringing up the cognitive function. So I think that's the main things I wanted to hit upon tonight. I'll leave it on, keep it radiating in my brain while answer some questions tonight. I do thank you guys for your attention. For my people who joined on a little bit later, this is being recorded. This will be up on IGTV when we're done chatting tonight. And for those who are joining via Zoom, I will put this up on my website, redlightdoc.com. If you're interested in learning more about photobiomodulation, that's my main spot. But Weber Laser is the one who makes this device. You can also look at their website to find more information about the helmet itself. For those who are local to St. Louis, very likely in the near future, I'll start offering this for patients at Apollo Cardiology, either during your office visit, or if you just want to come in and try it out, we'll set up some kind of sessions that you can do. But typically, to probably get the benefit, you're probably going to need to do it 2 to 3 times a week to really notice. You probably notice something, the first session, but to get the long-term benefits, probably a couple times a week is usually the key. And then while we're waiting for any questions to come in, next week, I think if I'm lucky enough to teach one of my friends how to use Instagram, I'll get her on to do an IGTV live IG live with me. She does a lot of photobiomodulation in town using the Weber Endo laser, and she actually had this helmet before me, so I got to use her helmet before I got my own. So maybe I can have a little Q&A, and she can share some of her experiences with using different photobiomodulation devices to treat her patients. But if that doesn't happen next week, I will get her on sometime. I can tell while I'm wearing this thing, even though its main thing is that it's bringing your blood vessels to dilate, it does make your head feel hot or just warm, just because of the way the blood is flowing. But the infrared light still is going to bounce somewhat off your hair and your skull, so it's not all penetrating your brain. So I think the only major contraindications to using this thing is you don't want your hair wet. You're not supposed to treat if you have any kind of tumor on your head, or if you're sensitive to infrared light. I don't know exactly the best way to test that. You'd probably test it on some other area other than your head and see if you have a reaction to it, but most likely you're not going to have a reaction to it. There are some drugs, not that I routinely prescribe myself, but certain antibiotics and certain seizure meds and such are photosensitive. So, if you're on those type of medications, you definitely would have to talk to your doctor about, what possibility of having a reaction is using something like this. But if you're generally healthy, it's not gonna be a problem. Somebody asked us, who makes this one? This one's actually made by Weber Medical out of Germany. The V-Light is a competitor product that I've not had personal experience with, but they were actually first to the market. They had a device that actually clipped to your nose for the most part, and then they do have one that kind of wraps around your head. I know for one of those things they actually have some red light that goes up, but if you're going in the nose, you can potentially penetrate the tissue at that level. But their main light, I think, uses the low 800 nanometer range. That would be an awesome question. I have not yet had personal experience doing both, but the question is, how do I feel about using low-dose methylene blue with red light therapy for mitochondrial function? It has been studied. There's, grab his name right here. I've actually listened to some very fascinating podcasts from him. Dr. Francisco Gonzalez Lima at the University of Texas, Austin has done that type of research. Methylene blue is a compound that is a electron donor in the electron chain transport. So it can get the electrons to that ATPase and get to oxygen to make water. So it's just something that can augment energy production in the mitochondria. It has a lot of other interesting benefits that I've been reading about lately. The best way to use it generally is going to be IV. There is some companies making some oral products for that. And if you're on Instagram, you see the people with the blue tongue. That's what they're doing, is the oral methylene blue. And I've tried it a couple times. It does kind of turn your brain on for a couple hours as well. Not that uncommon to the way that this actually feels. So potentially, if I was going to stack those, I would do the methylene blue first, and then after that's been kind of digested in the system, then put this on. And let me see. All right. So I need to move this around for a second. Got a couple of questions in the chat here on the Zoom thing, so let's see. Somebody asked, should a neurologist be involved with your decision to use it? This is something between you and your physician. This is not something that the average person is going to acquire and start using at home. This is going to be something that, for the most part, you're going to use it in somebody's office. I'm not going to go into the cost tonight because there's different price points for this depending if they're running any type of deals. If you're actually interested in acquiring the helmet, I personally just reach out directly to the company Weber Medical on Instagram. They're very good at getting back to people about things. But if you're in the St. Louis area, like I said, I will probably at some point in the near future have this at Apollo Cardiology for people to come in and try it out. Correct. I think that the question is that they also use it as a photosynthetizer in Germany. So there's other uses for methylene blue, but the main way I think about it is that methylene blue just makes energy production in the mitochondria more efficient. So this, to seeing myself, it definitely looks like the Doc Brown helmet from Back to the Future right now. Well, I generally try to keep these to about half an hour. I'll stick around for a couple minutes if more questions come in. If they don't, that's okay. I will be back next Monday night, 6 o'clock Central Time, going over either a IG Live with a friend talking about photobiomodulation, or I'll come up with another topic that maybe goes back to cardiovascular risk reduction. We're gonna hit upon those topics too, but it's been just an interesting ride down the photobiomodulation pathway the past couple of weeks. So maybe we'll do that again if I don't do it again next Monday. Question. Correct. So yeah, there are. Weber does make something called the Weber Endo laser, where they can do either laser acupuncture, or they actually do have needles that can go into the joint space or in the intravascular space, and then they can use different wavelengths of light. They can use UV. They have a blue, a green, a yellow, a red, and infrared spectrums for that device. Question, how much further does it get in the body? If you're just using this type of device, the reported data is that the wavelength only gets in maybe 4 to 5 centimeters. Your hair is going to block a lot of it, your scalp, and then the skull does. But there's at least some thought that if you're stimulating the red blood cells, you may have a further peripheral effect with that. Question, somebody with a neck injury. Good question. I don't know. I don't know if there's been much research for treating the brain directly for the neck. I mean, there's great photobiomodulation devices and laser devices that you can treat topically for musculoskeletal injuries. All right. Well, thank you again for everybody joining tonight. This was obviously an interesting topic for me to research and demonstrate for y'all. I'll keep this video up online going forward. Yeah. And if you have any questions, the best way to reach me is on Instagram. It's just direct message me at Dr. Twyman. If you want to email me, it's drtwyman@apollocardiology.com. So have a great evening, and we'll see you guys next week. Take care.